Hey, this is Steve Bell. Welcome to the Medtech Mavericks podcast. I've been asked to do this one by several people who've asked me to do a review of different robots that are out there other than just daVinci 5 and the obvious daVinci clones and the different soft tissue surgical robots. So I decided today to do a series of these, and I'm going to start today with Procept Biorobotics, which is we'll get into it in a minute, but it's a robot that's very different than something like a daVinci. So again, the problem with robotics is it's a catch-all phrase, and most robots are actually not robots in any way, shape, or form, but they have robotic components to them, so therefore they get classed as a robot. The classic, let me just go to here and pull this up for you, is that you would all be used to seeing this as a robot. This is what you'd all be used to seeing. This is what you'd all think as a robot. It's the daVinci. Oh, let me keep on that for a while. Don't move. It's the daVinci robot, a multi-arm robot for soft tissue robotics. But to be honest, that is not the only type of robot that's out there. So you've also got a series of different robots that I'm going to cover over the next coming weeks and months. And in my blog, already I've started to cover things like endoluminal robots. And today's robot, in some senses, is an endoluminal robot. They may not classify it as that, but it is a form of endoluminal robot. I'm also going to cover the endovascular robots, the neurovascular robots, the spine robots, the large joint robots. I'm going to cover them all because they've all got merits and they're all working a different way. And people who are working in spine, for example, will know the spine robots, whereas those working in soft tissue robotics may not know so much about the spine robots. So I'm going to try and do this. Now, again, these do take me quite a bit of time to do, and it is in my own time that I do this. So I'm going to ask now, one thing that I would really ask that you do to really help me and support my channel is a few things. So on the YouTube channel, what will really help me is if you follow the channel, and that'll push the video out to more people, and it'll also give you the videos when I upload them. It will automatically notify you the videos are there. The second thing that helps me is that if you like the video, and if you can go back and like some of my other videos, that again tells the algorithm of YouTube to push out my videos to more people, so more people get to see them and share with the information. The final thing that I'd ask as a big request is that I do have my blog as well, and you may have come to this via my blog, which is on howtostartupinmedtech.com. I would ask that you go there and go to the blog, and there's a free section, which is fine, and you'll get some information in the free section like this video today. But there are also the exclusive deep dives, and they do take me a lot of time, effort, and research to get those done, but they will contain masses of information. And if you're into this scene, if you're in marketing or sales, or you're an investor, or there's just a different role that you've got in surgical robotics or medtech, I would sign up for it. It's €20 a year. That gives you full access to every single article that's in there, plus all the past ones. Would encourage you to go back and look at the past articles as well. And I'm starting to build up a framework and a picture of soft tissue surgical robotics, and now I'm going to go more into the other robotics as well, so that anyone in this industry will get information. And some of this information, you would pay up to $10,000 for a report from a probably less informed research company that is basically just sort of throwing out the research on this. If you follow my blog for $20 a year, €20 a year, you should be able to get as much information as you'd find in most reports. So that would help me a lot. So YouTube, follow that. Right. Publicity over with now. What we're going to talk about today is we are going to talk about different robots, and the one that I'm going to talk about today actually is from a company called Procept Biorobotics. And you may have heard this is the aquablation, which is the aquablation therapy, and we'll talk about that in some details in a minute. And this is their new version for their aquablation robot, which they call Hydros robotic system. And as you might see, they've obviously put the words AI powered in there, because you can't do anything today in robotics without a bit of AI power, right? Again, as I've talked about on the AI2M conference, you've got to be careful what AI actually means. But yeah, there is actually some machine learning back here that's going to help, and I'll get into that later. And I will explain what this robot is about. But you can't help noticing that it feels actually very much like the daVinci 5 in terms of design cues. And I don't think that there was any copying going on by either of them forwards or backwards. But what you're seeing now on a lot of the robots is these large touchscreen formatted devices, beautiful industrial design, really nice color so that it's going to be used in low light ambience. And there's going to be, touch screens for the user and the operator so that it makes workflow easier and faster. And we'll get into in a bit the imaging that you get with this system and the ultrasound image that you get as a companion, and then how the AI works in this. The first thing that I need to do, though, is take us a little bit. I need to take us a little bit into the disease state that this covers today, because it's actually a very specific disease today. I think they're going to expand into several others in the future. But let me talk about the disease state first, which is benign prostate hyperplasia. And what that just means is that benign means it's non-cancerous. It's in the prostate, so it's a disease that affects men. And it's hyperplasia, which means you've got extra cell growth that you didn't want to have. And basically what happens is you've got a prostate is like sort of like a big apple like this. Oh, sorry, bang the microphone. There's an apple like this, and there's a central lumen, and that connects to the bladder. I'll get a bit more into this in a minute. I'll show you some diagrams, but that connects to the bladder, and your urine passes through the prostate. That's one of the fluids that passes through the prostate, and that's how you basically pee, right? So what happens is that the tissue starts growing and growing, and you get this hyperplasia, or this enlarged prostate. And what happens is the lumen gets closed down. And that can cause problems with evacuating the bladder, which is basically urinary retention. So it becomes hard for the guys to pee, and as they get older with this, it gets worse and worse. And it's not life-threatening in most cases, but it's it's got a great amount of discomfort for men, and basically it's very symptomatic. And some of that gets treated today. There's some different pharmaceutical treatments that give symptom relief. And then I'll dig into a little bit about the treatments that have been done over the years. And in fact, let me jump to my main scene, and let me jump to a few things here. So let's go here to, let's not go that one. Let's go here first. This is quite a nice little animation that I found on YouTube, and this talks about the most common way that this is treated today. So basically, you've got this extra growth that's in there, and what you're going to do is you're going to go in and you're going to remove some tissue. And one of the key ways that tissue has been removed for multiple years by urologists is that they go in with a cystoscope, and they have like you'll see in a minute, it's like a semilunar hook. And what they basically do is they put electrosurgical energy through it, and they burn away and scrape away tissue in little slithers, is probably the best way for me to say it. But let's jump in on this a minute and just see where it goes, and I'll help you to see.
Transurethral resection of the prostate, or TURP, is a surgical procedure during which part of the prostate gland is removed. The prostate is a walnut-sized gland in men that is located at the base of the bladder, where it wraps around the urethra. A TURP is often performed for a condition called benign prostatic hyperplasia. In this non-cancerous condition, the prostate enlarges to the point of causing difficulty with urination.
Now, I want you to think about this a little bit, because anyone who's watching this who's ever had a blocked drain, there are going to be some comparisons here, and Procept's going to hate me for saying this, but I know that I have a lot of non-technical users that come to my podcasts and my blog, so I just want to make sure that I also put this in simple non-medical terms so that people can understand it a little bit more. But imagine that you've got a drain and it's blocked inside. We're going to talk a little bit later about how they often get unblocked by some of the drain companies.
A TURP may also be performed in patients with prostate cancer to relieve bladder obstruction. When you arrive at the hospital...
But we're going to talk today about the benign. We are not going to talk today for Procept, but we will talk a little bit about where they're probably going to go. That might be used in cancer in the future, but today it's used in the benign prostate hyperplasia.
Surgery. An intravenous line will be started. You may be given antibiotics to decrease your chance of infection. A TURP may be performed under general or spinal anesthesia. If you're given general anesthesia, you will be unconscious and a breathing tube will be inserted into your throat to help you breathe for the duration of the operation. If you receive spinal anesthesia, you will remain conscious and the lower half of your body will be numb during the operation. You'll be given sedation to help you relax.
Now, me being an utter and total coward, I will be saying, give me everything, knock me out, take me out of here. I don't want to know a single thing about it. Personal choice.
Uncomplicated TURP usually takes about an hour to perform. Your surgeon will begin by slipping a small lighted instrument called a cystoscope through the opening of your penis. After instilling sterile solution through the cystoscope for better visibility, your surgeon will carefully examine the inside of your urethra, prostate, and bladder. He or she will then pass a resectoscope, which essentially consists of a small wire loop carrying an electric current, through the cystoscope and use it to shave off layers of prostate tissue.
Now that's looking quite gentle there. It's I might even try and find one later, but basically that's got a lot of high voltage electricity, and this is often monopolar, so it's passing through the tissues, and you got to think about that. It's causing electrical spread and it's causing thermal spread, which is what we'll come to a little bit later of why there's alternatives to it.
It will be washed into the bladder and out through a special port in the cystoscope. When an optimal amount of prostate tissue has been excised, your surgeon will remove the cystoscope and place a catheter into your bladder to keep it draining for up to 2 days after the surgery. Following the procedure, you will be taken to the recovery area for monitoring and given pain medication as needed. You may continue to receive antibiotics through your intravenous line, and a sterile solution may be flushed intermittently through the catheter tube to wash out accumulated blood and clots.
So there we go. So basically what we're doing there is we're going into the prostate, and we are going in with this hook. We're basically resecting away, and that's been done for decades that way. The problem with that is you've got to understand a little bit more of the anatomy around the prostate, which is it's actually more delicate than people think, because you've got several problems. So not only do you have the urine that passes through it, but it's got the seminal vesicles that come to it, and they basically have seminal fluid. So it's part of the reproductive system as well, and it has. A lot of people don't understand quite how this works, but the prostate, it actually helps with continence. So it helps to make sure that you don't have leakage of urine when you don't want leakage of urine. And what can happen is that when you do the TURP, either from taking too much tissue away or nerve damage, you can actually cause an amount of incontinence with that procedure. And that's sometimes because of excess thermal damage. Sometimes it's nerve damage because you've got electricity in there. But what it can also do is it can also allow retrograde ejaculation. So you can have seminal fluid go back up into the bladder, which is another problem of this. And sometimes then it can even cause erectile dysfunction. So there's sexual dysfunction that comes with this. And that's one of the main measures. Because it's not going to necessarily kill you, but it's uncomfortable. It's that trade-off for a man of, do I want to potentially risk incontinence and sexual dysfunction, or do I want to put up with some symptoms and have problems peeing? That's basically sort of what happens in the minds of a lot of men as they think about, do they want this treatment or not? So that's kind of the treatment that's been done. That's the focus of Procept, that what they're doing is bringing a new way of attacking this disease. And I'll talk about that in detail in a minute. I want to say that over the last 30 years, there's been several therapies that have been tried to replace TURP, transurethral resection of prostate. So there's been things like, there's been 2 or 3 different lasers made, including indigo, which came from J&J, and there was green light laser, which came from AMS. And what they were trying to do was use low-level laser energy to basically reduce and debulk the tissue that was in there. But the problem with these things is that they often came back because you sort of debulk them, and then they came back in. Then they tried even things like Theraseed, which was using small radioactive pellets that were placed in and around the tissue to cause the tissue to retract. That was tried. There's been multiple different approaches that have been done towards this. So roll forwards, and you came to the point of Procept. And let's talk a little bit about Procept. Let me get to my main scene here and jump in on Procept. So Procept Biorobotics, they've been around for well over a decade. And what they did is they said, well, actually, you could use cryo or you could use thermal, but the problem with all of those is that they have collateral spread. So, and this is where they're going to hate me on this, but basically, if you think about the way that several drain companies come and unblock a drain, so one of them is they come with a mechanical thing, which would be the equivalent of TURP, and they go in and they'll unblock your drain by basically rotovating through it. But then what a lot of them do as well is they actually use high pressure water. So they have like a super high pressure nozzle that fires forwards and backwards. And what that nozzle does is it breaks away the soft stuff that's inside the drain and the block, and it softens it up and it breaks it away. And what it does though is it's selective. It doesn't rip through your actual drain. That's one of the key things. So the interesting thing about high pressure water is that it's quite selective on tissue. So it'll take softer tissue, but it won't take things so much like nerves and blood vessels, depending on how you regulate the pressure. So you need a little bit of smarts in there to regulate the pressure and the direction of the jet and the shape of the jet that comes out of it. But basically what they do in drains is they push that up, and it basically pushes all the stuff out of the drain. So that's in basic the concept a little bit here, but it's a way smarter with the way they do it with Procept, and I'll get into that in a minute. Let me just be clear, though, that the idea of using water on tissue has been around since about 1988. And here's some old stuff from Hydros Surgery News from 2006. And they actually quote that in 1988, hydrojets were used in liver surgery. So, there's been different products out there for either aesthetics and plastic surgery to sort of do safe liposuction using water jets. And then there was, laparoscopic surgery for removing liver cells. Parenchymal tissue, which is the soft tissue of the liver, could be blasted away and leave the intricate structure of ducts and vessels behind. So this has been done for actually, a very, very long time in laparoscopy. And you can see here that people were even thinking about it there. So here's one good example where the hydrojet will take away the soft pulp of the orange, but it will leave the connective tissue in between. And you can go back and look at this at your leisure. So what Procept did is they understood that you could use this kind of hydrodissection and use it through a cystoscope-like device. And what you could do is you could basically carve out the inside of the prostate by using water jets. So you use water jets inside the prostate to remove that tissue instead of using electrosurgery or laser or cryotherapy. And they actually have a very nice video here. Let me see if I can find the nice video. I'm going to come back to this in a minute, but I think this is a really nice intro video down here that you can look at. And again, you can go to their site, which is procept-biorobotics.com, because they couldn't get Procept because that was owned by another company. But let's just look here. So what have we got going on here to kind of orientate you? So you've got, in the rectum, you've got an ultrasound probe, and that's what's giving you ultrasound imaging here to see what's happening to the tissue. And what they've got here is they've got the sort of the cystoscope that goes in, and that creates like a frame across the lesion or across the increased tissue. And then what they have is they have a second piece of this cystoscope that swings back and forwards like a pendulum. And, you can change the angle of that and the amount of pressure that comes out and how long it actually acts on the tissue. So what they do is they've basically mapped out the profile of which tissue they want to take away. And then what they do is the water jet sweeps back and forwards as they retract the central probe. And what that does is basically takes slices of the tissue away. And you can see there from the cystoscope image, it's basically wiping it away. So although I was being sort of a little bit funny that this is kind of like a drain removing high pressure water jet, it's in a way it's similar but way more precise. And what they can do with this then is they can remove that excess tissue that's in there, and the small slithers of tissue that come off with this are aspirated back out of the system, and they come out of the system. So in effect, that's what this robot does, and you can control it on ultrasound and visually as you go along. And basically what you're doing is you're doing a very controlled, or rather the robot is doing a very controlled resection of the prostate using a water jet. So that is a really nice way of using water, and part of that is that it doesn't have thermal lateral spread. So theoretically, and through their data that they show with over 50,000 patients, they get less erectile dysfunction, less sexual dysfunction, they get less incontinence than with some of the other methods that are used. And that's one of the reasons why people like this. And it is pretty precise. So they had a system out for quite a while, which was the aquablation system. And then what they've done since then is they've just recently got FDA clearance on a new system. And this is using a little bit better planning. And this is really about workflow. There's not a huge difference in the actual way that the device works. It still uses high pressure water to resect. But what this is a much nicer workflow, and it's got some AI pre-planning. So what have they done? If you think about all the procedures that they've done over all the years, they've collected a lot of data and understood the outcomes related to that data. So they've understood if you go too deep or you don't go deep enough, what that means in terms of recurrence or in terms of incontinence. And they've got that all thrown into their data machine. And what they're then saying is, when they look at imaging, the smart system can help to assist to map out the best profile that you should do for the optimal result. That's the theory for it. It's still got to be proven out yet, but basically what it's doing is it's working out what's going to be the best profile within each individual's prostate to get the best results with the least complications, if that makes sense. So let's have a little look at the Hydros video here for the planning. It's called First Assistant Planning. So what you're seeing here with the touchscreen, that the operator is basically able to modify the suggested map that's done. Now this is very much more akin to something like a Mako than it is to a daVinci. So if you take a lot of the spine robots, and I'm not going to do a huge amount of spine robots today. I'll come back to that video in a second. On the spine robots, what you do is you do preoperative planning, you do navigation, you do intraoperative imaging, and what you do is you set the boundaries of where the robot is going to operate. So it is more robotic in a sense than something like a daVinci. But it's not fully automated, and it's not fully autonomous. And there's a big difference between automated and autonomous. But this Procept is much more akin to in my mind, to something like more like a Mako, or for a large joint, or for a knee or a hip, or even some of the spine robots. It's much more akin to a navigated, planned robot, and the robot does more by itself than a intuitive would do by itself. So you set the course of where you're going to go, and then the robot's going to basically follow that pre-planned pathway. So you can see here that the operator is setting all the points so that sort of intraoperatively they can set and guide where the Procept is going to go, where the Hydros, is going to go. And that is basically it. it's a robot that basically uses a water jet to carve out your prostate. And they have some nice clinical data around this. So again, I would encourage you to go to their site and look at this. But basically, what they're showing is that it's safe. It's very safe. And they're looking at three things. They're looking at incontinence, they're looking at erectile dysfunction, and they're looking at ejaculatory dysfunction, which is often retrograde, but not only retrograde. And you can see that they've actually got very, very low rates of incontinence, or what they call de novo incontinence. So if you had incontinence before, or you had some problem before, then they don't cure incontinence, as it were. Erectile dysfunction, which is one of the biggest, if you actually look at the data that's out there, one of the biggest reasons that people don't take a BPH surgical procedure is because they're really scared about erectile dysfunction. They don't want to trade off urinary retention for erectile dysfunction. So they avoid it. Whereas this is actually showing incredibly low rates of erectile dysfunction. And it's still got ejaculatory dysfunction. It's got some levels of that in there, but it's fairly low. The water too is a little bit higher than I would have liked, but they've actually got fairly low rates there as well. And then if you look at their efficacy as well, and you can go in there and look at this, they start comparing to things like TURP. And you can go and look at the publications that are in there. And I think that this is a really nice overview of they have a nice overview of what they do in there. And it's a great alternative to I certainly, me personally, and there's a high chance because a lot of men get BPH. But if I had BPH, then I would definitely consider a Procept procedure as opposed to a TURP. I've never liked TURP at all for a few reasons. And again, we'll come a little bit to the robotics. Like any surgical procedure, part of the outcome is down to the technique used, so TURP in itself, and the fact that you're using electrosurgery within the prostate. But a second thing is the operator's capability and skill. And we talk a lot about, and it's not a word that I love that much, which is democratization of skill sets. But what I think it is I think that what robots like Procept can help to do is to remove the variance that's down to just manual skill. So I think that for me, again, having a robotic procedure like this, which has got some smarts in it, it's pre-planned, it's got a good application of technology rather than using electrosurgery. It's using non-thermal ablative technologies, and it's got a robot that's basically doing it so that the maneuvers that are done inside are extremely precise and pre-planned and to a plan. Now, if you screw up the planning, of course, you're not going to get great results. But generally, and again, the Hydros, compared to their older system, is trying to give a little bit of smarts in there to give better guidance to the users, so that they can plan out and map the procedure ahead of time faster, and they can make just minor adjustments where they use their clinical intuition and their clinical insights to change that. But for me personally, I think this is an awesome alternative, and again, I think it's a really good use of robotics. A couple of quick things just while I want to go to my main scene here. Right, so one of the things that is different here is that you've got this new consumable, which means that basically you've got the probe that they use to do the aquablation is now in a disposable consumable for convenience. And again, pretty much on that, because anything that's got lumens within lumens within lumens, and you're trying to be precise, coming down to the reprocessing for the cleaning, not brilliant ever on the cleaning when you've got thin, small lumens. The water jet nozzle on this really has to be precise for it to get the kind of tissue effect that you want to get every single time. So I think their data may have shown that having a disposable consumable is better. And again, just from turnaround, if you're doing multiples of these, so there used to be a thing in Stafford, and everyone's going to hate me for saying this, called Wet Willy Wednesday. And they would just bang through sort of 10 TURPs in the morning. So if you were going to have a session in an ASC or something like that, where you're going to crank through 10 of these quickly, having a disposable on the end of it, which means that you don't have to wait for the turnaround, or you don't have to have 10 of these sitting around, especially a high precision water jet system, I think just makes sense. So a lot of people will say, oh, they're just trying to make money on this. I don't think they are, actually. I think that this is the sensible way for Procept to implement their technology to make sure that you get a fresh, clean, with a really precise nozzle every time. There's a lot of pressure going in these. And then the second thing, as I say, I just like what they've done with the console. And you can see here that you've got a trigger switch. So it's not autonomous, okay? It's automated, but not autonomous. And this is something I'm going to talk about a lot when I talk about spine robots. I'm going to talk about dental robots. I'm going to talk about some of the other robots. Is where does automatic become autonomy is different. But what you should know is that the clinician here, the urologist, is always in control of this device with their foot on the foot pedal. It's what like a dead switch. So if they ever lift it off, the system will stop immediately. So if they see something that they don't like, then they will immediately see it. Now let me see if I can zoom in here for you. Right. So on the screen, by the way, just to say, you've got your ability to set up the navigation. What you see during the procedure is you'll see the ultrasound image, which takes precedence on this, because I think that's the main thing that the urologist is relying upon. That's the prostate in there, by the way. And what you've also got, though, is you've got a cystoscopic view. So you're getting twin views with this system. You're seeing an ultrasound view as it's doing it, and it's doing its movements back and forward. And you'll actually see the cystoscopy view as well, so you can see the direct application on the tissue. Why is this important? Because if you were to get excessive bleeding, or there was something that was a problem in there, the urologist can step in and intervene on any of that bleeding that would potentially happen. It's it should be a rare complication, but it can happen. You wouldn't see that so much on the ultrasound, but you would see it very much on the main camera view. And that is about it. They do have a lot of clinical data, so 150 peer-reviewed publications. Go and look at them, quite interesting, and 50,000 procedures. This is another interesting thing that I just do want to talk about on the Hydros system, is that it's FDA first. And this you're going to see more and more on the world of robotics, that you're going to see FDA first. MDR has just made it so difficult for a lot of these procedures or systems to get clearance. So you're going to see more and more FDA firsts coming. Final thing, just if you're in the United States, is that any technology that you introduce has to get reimbursement, and there is two things. There's coding, so what's the codes that's used to give you the payments, and what's the coverage, i.e. who says, yeah, you might have a code, but I'm not going to pay it. You got to look for both coding and coverage, and you'll see that there is reimbursement there. I'm not going to go through it now because I know I have a lot of international visitors there, but if you go to their website, go and look at their reimbursement if you're in the US. Very interesting. And I will leave you with this beautiful shot there of the Hydros. Yeah, so that's it really. I just today wanted to go into different types of robots. So not all robots look like a daVinci Xi. I think that's an important thing for us all to understand. And I am going to do this whole series on different robots to try and give us a bit more education around other robots that are out there. I really like the Procept robot. I would personally have it, and this, I'm not paid by them in any way, shape, or form. I'm not even talked to anyone from Procept, but I think it's just from me, from my knowledge as a physiologist, having been in surgery for many years, having dealt with urology for a long time, seen a lot of TURPs in my time. I just think this is a slightly kinder and more precise way of doing it, and especially as you can't always get to choose your urologist, so bringing robots into surgery or into dentistry or into neurovascular is going to help, because you're going to start closing that bell curve down and reducing the variance that's through user variance. So I do like it. So if you found this useful, please go and give a thumbs up on the YouTube channel. I know quite often we just watch these videos and then move on to the next video. A thumbs up would really help me on the channel. Follow me, so subscribe and turn your notifications on, because I'm going to do a lot of these over the next couple of months. we'll give you that. And please, if you want to support me, go to my blog and put your hand in your pocket, get the €20 in, and you'll get tons and tons of free information, of course, but there is a lot of exclusive information in there that I reserve just for the people who get the blog. And again, part of that is because the bots suck up everything. By the way, if nothing's behind a paywall, in case you're ever doing a blog or anything, the bots can suck up everything, and they do. And I found some of my articles just get literally sucked up and republished it on somebody else's blog. So having that paywall there just stops that. Really easy. Throw your credit card in, €20. Please support the blog, and it'll encourage me also to do much more blog articles. Got a load of those coming over the next sort of 3 months, 6 months, and 12 months. I've got a massive list of stuff that's going to be on spine robots. It's going to be on the new emerging systems in soft tissue surgery. It's going to be on dental robots. It's going to be on endovascular, endocardiac. It's going to be robots for neurovascular, some of the really interesting systems that are coming there as well. So any support will really help me. And again, thank you very much for coming to the Medtech Mavericks podcast, and I hope to see you soon with another robot. Take care.